Every December, KDKA TV and radio are honored to continue a tradition that was started 6 decades ago. It's Hospital Free Care Fund benefit show to help ensure that every child in our area receives the care they need, regardless of the family's ability to pay. It's a time of sharing incredible stories of patient courage, remarkable care, and thanking our community for its generous support of the Free Care Fund. This year's benefit show is coming up this Thursday and every day here on PTL. Until then, we will be meeting some young patients and their medical caregivers to hear how Children's Hospital is making a difference in their lives. And we are starting today with a young man who knows very well how his care saved his life. We want to welcome 16-year-old Sean Nolan and Children's Hospital UPMC oncologist Dr. Randy Windreich. Thank you both for being here.
Thanks for having us.
So, Sean, you're 16 years old now. Tell us a little bit about what happened and how you ended up at Children's.
So last September, a lump started to grow on the right side of my neck, and at first it was really painful. And so like I'm going to school and talking to my friends, and I'm just like looking back and forth, and like I can barely move it, like I have to move my whole shoulder.
We can see in this picture.
Yeah, so
was this shortly after? How long did it take to develop like that?
It grew within probably like 4 days.
Wow.
And it just kept, and sooner or later it just like stopped growing and it was just there. So for the first month I was treated for swollen glands. And so I got put on a bunch of different antibiotics and just nothing changed. And so at the beginning of October, we went to an ear, nose, and throat specialist, and he told us it could be anywhere from swollen lymph nodes to lymphoma.
Wow.
And so that's whenever my heart just sank.
Well, I'm sure your parents too. You know.
I looked at my mom and we just didn't know what to say, like we were speechless. And we called my dad and did a needle biopsy and got the results that it was lymphoma. And then a week later, and did a normal biopsy, so like they cut out a part of it to find out what it really was. And we got the results that it was Burkitt's lymphoma.
Wow. And so, doctor, tell us a little bit about what this is. What is Burkitt's lymphoma?
So Burkitt lymphoma is a rare type of non-Hodgkin lymphoma. It's a very rapidly growing and very aggressive form of lymphoma that's usually treated with multi-agent chemotherapy. So Sean, unfortunately, had a very treatable kind of lymphoma of Burkitt's. Even within 3 days of treatment, the baseball-sized tumor that he had in his neck really shrunk down to next to nothing.
Wow.
I mean, you can really see it right before your eyes.
Unbelievable. But I understand, Sean, did you go to like an urgent care first and they said 99% chance it's probably nothing, but there is a 1% chance that it could be something more serious?
Yeah, it was within that first week of the lump, like we had no idea what it was yet. So the guy says, the doctor, he tells us it's 99% swollen glands, it's 1% something else. So we're talking, me and my parents, and we're like, okay, it's swollen glands.
Chances are it's nothing.
We're fine, yeah. And a couple antibiotics will fix this. And then it turns out a month later that it is that 1%.
Wow. So talk about how important the care was that you received at Children's.
I mean, the medicine, of course, was the most important part of the whole thing and getting me better, but the people I met there just made the treatment that much more bearable. Like Dr. Randy and my other doctor, Dr. Allison, they always came in to check on me and see how I was doing, and they would tell us every day what the plan was for that day. And so we would have a goal every day, and we just have to meet that goal and just take it day by day.
Yeah.
And all the nurses there were amazing. I became friends with all of them now. Like I still talk to them.
That's
and
so nice.
Arlen, the housekeeper, me and him, he would come in and we'd play Xbox with one another. But yeah, I mean, everybody in that hospital just made the journey that much more bearable.
I understand that you were really disappointed, obviously, when you found out this news. You had so much going on in school last year, and you had to take several months off of school. Is that right?
Yeah, so it was my sophomore year, and I was supposed to be in a school play. It was actually a month away.
Oh.
And so we were working so hard, and then to get the news that you wouldn't be able to do it. And so, like, I never really cried whenever I found out that I had lymphoma, but it really hit me whenever I found out I wouldn't be seeing my friends, I wouldn't be up on stage, I wouldn't be playing basketball. So it was really just like taking that normalcy out of my life.
Right.
Really just got to me and my family.
And so everything is back to normal somewhat now, right?
Yeah.
And you're finding ways to give back to children's at this point.
Yeah, I mean, at first we didn't know why I was given lymphoma, why God did this to me, but now we know that He has plans for all of us, and now we know that He can use my story to help other kids, help us raise money for such an amazing organization, an amazing hospital.
Yeah.
And so He's using my story for good.
And Dr. Windreich, tell me a little bit about some of the patients you see. As an oncologist, I mean, this is probably such a tough job, and how important is the free care fund to make sure that these kids receive the treatments that they need?
So we typically have about 160 to 180 new cancer diagnoses per year at Children's Hospital. And just think about these kids who go through anywhere from 6 months to 3 years of treatment, all the visits either weekly or even monthly at some points. I think the back and forth, the wear and tear on the cars, the overnight stays, I think it's really difficult for families to be able to afford this, especially when one parent or even both parents need to take off work during this time.
Yeah.
So I think any extra funds coming in to help them out is really appreciated.
It's just such a hard time for families, but Sean, we are certainly glad that you are healthy now, and you're a junior now at North Hills?
Yes, I am, yeah.
Great. Well, thanks for taking some time out of school today to be with us today, and Dr. Windreich, you as well. Thank you. And you can watch here to learn more about how you can help children like Sean and others being helped at Children's Hospital when KDKA presents the 64th Annual Free Care Fund Benefit Show. We'll be broadcasting live from the hospital and the PPG Winter Garden this Thursday, starting in our 4 o'clock newscast. Then the benefit show itself is from 7 until 8. Your donations help ensure that every child in our area receives the expert care they need. If you make your donation before tomorrow, your name will be added to a ticket during the benefit show broadcast. Keep watching every day here on PTL leading up to the telethon when we continue to feature patients and their medical teams that have helped them and their families. There are some great stories to tell, as you just heard Sean's.